Hi, this is a message from the Living Well program under the League for the Deaf and Hard of Hearing and Ear Foundation. This is information about the H1N1 flu. You probably heard a great deal about it, and at one time it was called the swine flu. The vaccines aren't fully tested yet for H1N1 virus, but it's recommended by the CDC that you get a vaccine as soon as they come out. You should also take other vaccines for the seasonal flus, and that means you could end up with 2 to 3 shots at one time. It's recommended that you get vaccinated. There are ways to protect your health from the flu, and you should teach these particular ways to your children as well. 1. Cover your nose and mouth with a tissue when you cough or sneeze. Throw the tissue in the trash after you use it. Then wash your hands with soap and water, especially after you cough or sneeze. If there's no tissue available, cough into the crook of your elbow. Remember that when you cough, the sneeze and the germs can travel as much as 70 miles per hour, which is very fast. It just goes as far as you can imagine. So cough into the crook of your elbow or into a tissue. Number 3, avoid touching your eyes, nose, or mouth. That's how germs spread. Number 4, try to avoid close contact with sick people. And if you are sick with flu-like symptoms, the CDC recommends you stay home for at least 24 hours after your fever is gone. You must stay home "24 hours after your fever is gone, no medicine." That means you can't take any fever-reducing medicine. It has to be a natural loss of fever. There are other important actions you can take. Follow the public health advice regarding school closures, avoiding crowds, and other social distancing measures. Be prepared in case you get sick and need to stay home for a week or so. So what do you do if you get sick? You stay home. Some of the symptoms could be fever, body aches, runny or stuffy nose, sore throat, nausea or vomiting, or diarrhea. When you have these symptoms, you should stay home and avoid contact with other people. If you need medical care, you may go out then. Now, if you have severe illness or you are at high risk for flu complications, it's important that you contact your health care provider or seek medical care. They can test you for the flu, and if you have the flu, they can give you antiviral medications that will help to reduce the symptoms of the flu. Now, in children, emergency warning signs are fast breathing or troubled breathing, bluish or gray skin color, not drinking enough fluids, severe or persistent vomiting, not waking up or not interacting, being so irritable that the child does not want to be held, flu-like symptoms improve but then return with fever and a worse cough, emergency signs for adults. These are warning signs. Difficulty breathing or shortness of breath. Pain or pressure in the chest or abdomen. Sudden dizziness, confusion, severe or persistent vomiting. Flu-like symptoms improve, but then return with fever and a worse cough. If you have any other questions about the flu, the H1N1 flu, check the website for the CDC or contact your local health department. Thank you.